So I was given this incredible job this morning to introduce Miss Claire Anderson. I have to listen to her, but I also have to listen to Jeanette. So Jeanette told me I have to read this. She gave me different instructions, so I'm going to do both. Okay, so Claire Anderson is the Senior Policy Fellow at Chapin Hall, the University of Chicago. Ms. Anderson is the National Thought Leader. She worked with us on economic and concrete supports as a core to prevention of child welfare involvement and the development of a family and child well-being system that prioritizes support and cross-sector partnership. Janet, I did my job. Okay, now Claire says she wants me to tell you, she's a social worker. She's lovely. And she really believes that, like me, we can make a difference with very simple, concrete support for families. Let's give it up for Claire.
It is such a pleasure to be here for so many reasons you all cannot imagine. It's like the 33 years of my career sitting in one room, California, Kentucky, Iowa, California. It's just really special to be here with everybody. Thank you for having me. And you're right, I'm very committed to economic and concrete supports. In part, I'll tell you the story before I get started. I don't know, maybe 3 years ago, maybe 4 at this point, I saw 3 studies, sort of back to back. They landed in my inbox in a variety of different ways, listservs, somebody mentioned something. I saw a study about the minimum wage, having a relationship with child abuse and neglect. I saw Medicaid expansion having a relationship with child welfare involvement. And I saw one other study and I said to myself, well, that can't possibly be true. If that's true, then much of what I've been doing for a long time might not be consistent with this evidence. I need to go to school and learn about this. And so what you'll see today really is my effort to try and understand something a bit better, and just more than thrilled to bring this knowledge to you. Hopefully some of you have seen this before. I know the folks in California, I came to the Linkages 2.0 kickoff and shared a lot of this, so I'm really sorry you're gonna have to sit through it again. Hopefully it'll have a different meaning today. It has a different meaning to me every time I see it. And at this point, I'm presenting this data literally multiple times a week. I'm going from here to 600 people in New Jersey tomorrow. So like every time I see it, it means something different to me. And in the context of TANF and child welfare partnerships, I would say once upon a time, it meant one thing to me. Way back at Linkages 1.0, way back at Dave Burns in El Paso County, almost 20 years ago, it meant that TANF would help child welfare. Today, I understand it as TANF is the prevention arm of our federal policy structure. Who here knows off the top of their head, word for word as I do, the first purpose of TANF? Anybody? Anybody? I see 2 hands in the back. Anybody? I see 3 hands. I'm going to tell you what it is, and then I'm going to show you the slides. I should have already started the slides. The first purpose, the first statutory goal of TANF is to support needy families so that children can be cared for at home or with relatives. That's the goal of TANF. That's one of the 4 goals. And I hope by the end of this presentation and by the end of the day, that first goal means something very different to you than it did when you walked in. And it is my deep hope and my absolute aspiration that at the end of this learning community, it will mean something far different to you than it even does at the end of the day to day. And that what you learn, you can transmit to the rest of the country. Is that a deal? I'll make that pact with you all if you'll, okay, I see a lot of head nods. Okay. In other words, this is not an academic exercise. I'm going to bring a lot of academic studies to you today, but this is in no way an academic exercise. This is an exercise in changing policies, aligning our work and our resources to meet the needs of families. All right? Okay. Fantastic. Because, and this is the academic part.
I'm not critical at all.
Well, it's a beautiful challenge, right? It's an inspiring challenge. It's a charge to us, and I accept it. 30 years of evidence shows us that when you reduce access to economic and concrete supports in the lives of families through a variety of ways, economic shock, somebody loses their job, there's a predatory loan, their rent goes up, they lose their benefits, they're on the cliff, their health coverage changes, is associated with increased risk of child welfare system involvement. On the flip side, that evidence also shows us that when you increase access to economic and concrete supports, risk for involvement with child welfare is decreased. And you're going to see this across all kinds of studies, across time in studies. And when I read this evidence and you sit back and you look at it as a whole, what you sort of come to is that the mechanism by which it's provided or made accessible to families may not matter, whether it's cash, basic assistance, whether it's childcare, housing, healthcare, employment, or all of them together. Families are stabilized. They are able to buffer those economic shocks in their lives in a really different kind of way, and risk goes down. Said even differently, I'm not sure that if any one of us experience the kind of economic shocks or volatility on the edge of scarcity, that the families that we are working with every single day, that we too would not be at exponential risk for coming into contact with the child welfare system. And I'll show you a slide about that later. Okay, so this takes that, oh wait, I'm gonna go back because this is not an academic exercise. This evidence is actionable. You can do something with this evidence when you walk out of the room today. And I accept the charge and the challenge. Oops, wrong way. Because I'm doing something different today than I was a year ago, or even 4 years ago. Like how I spend my time every single day has changed completely because of this evidence. Okay, decreased access to economic and concrete supports is associated with increased child welfare system involvement. I just said that, but here's it blown up, right, at a super high level. We see studies showing us that when you reduce TANF, families don't have childcare, lack of stable housing, reduced income and negative earning shocks, reduced employment. And there's even one fun study showing us, that's a modeling study that looked at when gas prices go up, we see more involvement with child welfare, like less discretionary money in the pockets of families. On the converse, increased access is associated with decreased risk for child welfare system involvement. We see this across macroeconomic supports, concrete supports, public benefits, and child welfare interventions with economic and concrete supports. Again, most of our efforts to date in connecting TANF and child welfare have been about that box over there, right? There are a whole bunch of other boxes in which we can make this evidence actionable. Okay, it's important to understand the policy context because that's what we've got to at least first frame our thinking around. Child welfare really has been a reactive system, right? We wait until families come to the front door, and then when they're at really much higher risk, some trigger upstream has said this family has a particular set of needs, and we think the child is at risk, and so then this other system responds. But the evidence shows us that there's a different way to think about this. And yet, from the very origins of the child welfare system, economic and concrete support policies and programs have been administered, have been statutorily separated as if they have nothing to do with each other, right? And here are a couple of places that are really important for us to understand in this context, in this room today, where and how they were separated, because it has, implications for what we do going forward. Way back in 1935, the Social Security Act bifurcated aid to dependent children, later AFDC, later TANF, from the Children's Bureau. Even though the founders of the Children's Bureau were advocating that they be put together, they were separated. And then later in 1961, the Social Security Act and its amendments, in response to the Fleming Rule, which is very wonky but important, which said that you can't just separate families from their children if the children from their families if the home is unsuitable. You've got to either make the home suitable by providing supports or place the child into some level of foster care. The next year, a year later, the Social Security Act responds to the Fleming Rule, and it creates an open-ended entitlement, what's now 4E, our child welfare funding stream. It creates that open-ended entitlement to support what? The removal of children from their home and placement into foster care, and provides no corollary open-ended entitlement to provide supports to help the family make the home suitable. Highly problematic. And we see this pattern repeated over and over again, including in our most recent child welfare policy that said, yes, child welfare actually can spend its money in the prevention space, but it doesn't connect it to TANF specifically. It doesn't reunite these, and it explicitly leaves out economic and concrete supports as a strategy to support families. We just see this pattern over and over and over again. This is the policy context in which you all will likely have something to say by the end of this learning community. Yes? Yes. Okay. So what does all that give us? We have economic hardship in this country, disproportionately in families of color, and across the entire spectrum of families, right? We have a fragmented human service system. We keep bifurcating these parts of our systems that could better work together. We have deficit-based, rigid, and piecemeal policies, right? Let's call those administrative burdens just for the sake of argument today. And then we have CAPTA, the Child Abuse Prevention Treatment Act, that mandates all kinds of professionals in our communities, and in some states, kind of everybody, to report any suspicion of abuse or neglect to the hotline, to the Child Protective Services hotline. And then we do have this disparate access to economic and concrete support. So we end up with families who are overloaded. They're destabilized, economic shocks, lack of access to resources, high rates of reporting, and then the deployment of the governmental authority to investigate families and remove children from their home and long-term child welfare system involvement. That all is happening in the context of that first statutory goal in TANF. Okay, Who now can repeat the, anyone now know the first purpose of TANF is to support needy families so that children can be cared for in their home or with relatives, right? It means something different to you now, right? Even now than it did hopefully 15 minutes ago. Okay, we're going to now go really swiftly. I've given a lot of like lead in time to a bunch of the evidence. So we're going to now kind of pick up the pace. Never fear, you'll have access to these slides and many more. And literally a 17-page reference list. So don't worry if you miss something, you'll have access to all this data. 60% of substantiated child protective services responses in the US relate to neglect only. It's an enormous overlap here, but there's a lot in this box. Don't be confused. There's a lot in this box: substance use, domestic violence, mental health challenges, lack of access to resources. But the evidence, to my read, suggests that whatever is in this box, economic and concrete supports are having an effect. And we've got a couple of studies or some qualitative data that suggests that's right. In other words, economic and concrete supports may precede or exacerbate those challenges in ways that would not be happening if sufficient economic and concrete supports were available in families, okay? And you'll see throughout the provision of economic and concrete supports is associated with decrease for both neglect and physical abuse, okay? So what you need to understand, or what I've kind of had an evolving understanding of, is that that there's a shorthand. Sometimes we say poverty doesn't equal neglect, right? Anybody heard that or like been playing around with that? I think that it is far more nuanced than that. I don't think that there's an army of child protective services workers and mandated reporters out there that are confused. This family's in poverty, so I'm going to report them to CPS. That does happen sometimes, absolutely, right? The family doesn't have a house, or the kids don't have coats, right? That absolutely gets reported. But it's not just that this evidence speaks to, okay? That's back. Okay, nearly 85% of families who are investigated by CPS have incomes below 200% of the federal poverty line. I read this in a couple of different ways. One, we point child protective services at families who have very limited resources. That's problematic in and of itself. Another way to read this is that families who have more like I said in the prior slide, families have more resources, are able to meet their basic needs. They're able to buffer against these other more complex problems, and they don't come to the attention of child welfare. Okay, so this is a very busy slide. I appreciate that. Again, you don't worry, you'll miss a lot here. You'll have access to all of this. But this does help us understand that poverty and child welfare system reporting to child welfare do run hand in hand with each other. And that it has this relationship has intensified almost 40% between 2009 and 2018. So something new is happening, right? So how we understood this a decade ago, or our mental models about what happens, like we all are walking around with mental, right? We need to understand that something more is happening in terms of this relationship and what the stressors of poverty cause in families. The researchers here say a few things. One, they say that we have to build that two approaches to reducing maltreatment through economic means could include building policies and practices to reduce the level of economic hardship for families in general. That happens way before child welfare, right? Reorient human services to recognize the core and expanding importance of poverty as a fundamental threat to human functioning. Right? That's about you all. And I think that you all have the opportunity to show the country the way forward. That's why I think you're in the room here together. Okay, so let's look at this way upstream of child welfare. And this is families who are receiving TANF, is the population of families that were part of this analysis. Those families who are receiving TANF, low income, and they experience one material hardship, their risk of a neglect or physical abuse investigation go up. And if they experience multiple hardships after experiencing no hardship, right? So there's a shock. Something happens. They're off kilter. They're destabilized. They become overloaded. Their risk of a physical abuse investigation goes up exponentially. 7 times is an enormous bump in risk. This tells us what we should be looking for in TANF families, right? Families who are receiving TANF, right? Okay, so this is getting closer to the front door of child welfare. Oh, this is like right at the front door of child welfare. We know that the strongest predictors of investigated neglect reports, so this is the report's been made and somebody decides to do an investigation. Food pantry use and cutting meals, so food insecurity, housing insecurity, short duration of residence, difficulty paying rent, utility shutoffs, this economic shock of some description, inability to receive medical care or pay a medical bill probably for a sick family member, and public benefit. We actually think that this one's a little interesting here, right? Because you're going to see over and over and over and over again that receipt of public benefit is actually a buffer. We'll look at that pretty quickly. My hypothesis here is that it's like a spotlight effect. All right, so families are likely in this instance seeing more people who are offering benefits or and likely coming to the attention of child welfare in a way that they might not have otherwise. On the other side of the slide, we see that the most reliable economic predictors of child welfare involvement are income loss, cumulative material hardship, and housing hardship. All right, so these are families who've been investigated and the CPS case is closed, recently closed. Those families who experience a negative earning shock, about a 30% reduction in a quarter, increases the risk of a subsequent investigation and increases the risk of a physical abuse investigation by 26%. And each additional negative earning shock is associated with a 15% greater likelihood of a CPS involvement. But, of course, in this particular study, right? It's probably the problem with academic research, right? Every researcher looks at these things differently. In this particular study, it was a reduction of 30% in a quarter. But again, you know, like at the very beginning when I said, I don't think it really matters the mechanism by which we're resourcing families. I read all of this as a body of science as a whole, right? It tells us something. And we see these things. I don't think that economic shock of 30% or more is much different than what we learned from this, right? Multiple material hardships after no material hardship, right? Accessing sufficient public benefits when a negative earning shock occurs effectively buffers against the risk of additional child welfare system involvement. And it's particularly strong for families with young children. We see a decreased risk of 50% for physical abuse investigation when they've accessed sufficient resources. Let me pause here to remind us that the highest age population of kids coming to the attention of child welfare, removed from their homes, and in foster care are children under the age of 5. They are also at exponential risk of child fatalities, right? That's our largest group of child fatalities as well. So this evidence tells us something about how we might shift, align, or reorient, was Kim and Drake's word, reorient our human service sector. This may be probably the most important study in the entire set of studies that I bring to you today. It's a randomized control trial, the gold standard of studies. Maria Canchon, she's at Georgetown University here in Washington, D.C. She looked at moms who were participating in TANF. And in this particular instance, the state that she was reviewing had a waiver for child support. It allowed the state to provide an entire pass-through of the child support dollars and not take an administrative cut of those dollars. So the moms got all of the child support dollars compared to the moms who got the child support dollars but had the administrative cut, right? So there's not any difference. Everybody was receiving child support. So there's nothing sort of characteristically different about these two groups. The only difference that wasn't controlled for was this administrative dollars. They were 10% less likely to have a child subject to a screened-in maltreatment report, and even a modest increase in child support payments averaging $100 per year resulted in a decrease in screened-in maltreatment reports. I actually called her and asked her about that. I thought it was a typo in the study. I called her. I said, is that right? So because I am at an academic institution, and sometimes this is an academic exercise, I have to give you a theoretical model that undergirds how to think about this. But I'm going to give you another one later that turns this one on its head. The family stress model helps us understand economic, material hardship and all the steps along the way, higher cognitive load. Anybody ever get stressed at work and feel like they don't have as many cognitive resources to take care of all the things? Oh, I see a lot of people smiling and laughing and shaking their heads. This never happens to me. I never have decreased cognitive resources. I'm always nurturing in my relationships. I never have conflict in my household. Right. This is just what happens to us when we are under enormous stress, right? It increases our risk for less nurturing, responsive, and supportive relationships and parenting, and places families at a higher risk for child welfare system involvement. The rapid survey at Stanford Center on Early Childhood has tested the first half of this family stress model empirically. They don't say it quite like that. I will here just to connect the dots between these two. And they were doing surveys throughout the pandemic to understand families' experiences of increased and decreased resources. And empirically, they've been able to show that financial difficulties generate emotional distress in the parent, which then creates child emotional distress. So we see this empirically. And this is a nice visual representation of families becoming overloaded. So the boxes that you see and the words on the boxes are the slide that you saw earlier. Right, so this is converting the academic literature to really a metaphor that we all can understand. Right, so economic insecurity, income loss, cutting meals, short duration of residence, difficulty paying rent. If you load 5,000 pounds onto a truck that has a payload capacity of 3,000 pounds, that truck does not function as designed. Neither do we, and neither do families. Okay, it's important to understand most of what I've been saying to you thus far is triggering a part of our brains that centers the family, right? The family becomes overloaded. We've got to get economic and concrete supports to the family. the family is the target of our intervention, right? Anybody else having that train of thought? I did for 30 years. Anyone? You can admit it. I am up here admitting it. This research helps us to understand that the context is an equal target of our intervention, if not perhaps more so. You know, the ecological model has the family in the center and everything else is supposed to like target the center. What if we kind of turn that on its head and we thought about that reorientation and the alignment of resources at the center, and the family is on the outside telling us what to do? That's a different way. That like it, all of this sort of turns our modeling, our mental models on its head a little bit if you sit with it long enough. Economic factors are associated with the neglect outcomes above individual level parenting behaviors and capacities. The association of individual factors, even substance abuse and mental health, with child maltreatment is reduced after accounting for poverty experienced by families. Parents have known this all along, ladies and gentlemen. This is the Children's Trust Fund Alliance and Casey Family Programs, the Birth Parent National Network, and a Birth Parent Advisory Committee. And in, I think, 2020, came together and said, okay, we've experienced the child welfare system, and we have a particular point of view about what transformation looks like. It's not about changing exactly what child welfare does on a day-to-day basis. It first starts with a humanitarian society. And I know you can't read this, so I'll just sort of tell you what it says. We believe, parents say, that we start with federal laws and public policies that redress child and family poverty, meet children's basic needs, and strategies like food, housing, education, childcare, transportation, healthcare. And we're going to look at a whole bunch of studies about that. We'll start with the National Academy of Sciences, their 2019 roadmap for reducing child poverty, model what it would take to reduce child poverty by 50%. Recently, researchers have modeled that data against CPS investigations and found that depending on the package, investigations could be reduced by 11 to 20% annually, and that would particularly reduce racial disproportionality, and that 11 to 20% changes to 19 to 29%. And why is that important? It's really important because Child Protective Services investigations have become almost normative in this country. Over half of Black children experience a CPS investigation by the time they turn 18. I think if we were to pull people off the street and ask them, do you realize that our policy choices are likely resulting in over half of Black kids experiencing a CPS investigation? I think they'd be shocked. They would be equally shocked to know that almost 40% of all children experience a CPS investigation by the time they turn 18. Okay, we're going to look at some of the evidence that Director Flagg and Commissioner Schomburg talked about, specifically about the relationship of decision-making in TANF and child welfare system involvement. Each additional state policy that restricts access to TANF and the 4 ways in which TANF policies were restrictive in this particular study is associated per 100,000 children, 50 additional children with substantiated neglect reports, 22 kids entering foster care due to abuse, and 21 additional children entering foster care due to neglect. Remember, abuse and neglect. Oops. I need to pick up the pace, so I need this to work. A 10% increase in the state public benefit levels, and this looked at the time span right around 1996. For a family of 4 is predicted to reduce foster care placements by 8%. Anyone, first goal of TANF? Okay. We also can look at this at the at the state spending level, so not just TANF, but all spending by states. This study, this modeling showed us that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a reduction in substantiation foster care and an 8% reduction in child fatalities. What's old is new again. Anyone know Dave? Did anyone know Dave Burns? Anyone get to work with him? Wasn't he just the loveliest man?
The most amazing.
We would not be sitting in this room probably were it not for Dave Burns, who way back ages ago, I mean, this was at 2003. He had been doing this work for probably 5 or 6 years at the time that this paper was written. His vision was that temporary assistance for needy families would consider itself a child abuse and neglect prevention program, while the child welfare program would consider itself an anti-poverty program. Words to live by for us. I don't think we achieved this beyond his vision at the time, but you all have been convened together to reconsider his wise words. So what are state policy? I mean, there are a lot of state policy options that you all are probably thinking about. I'm just going to put one or few up here. Vermont has created an economic diversion system. It has the highest rate of child maltreatment referrals in the nation, but the lowest rate of screened and neglect cases. It has an economic firewall, interagency collaboration, and service coordination, that reorientation that we heard about way earlier. Multidimensional diversion program system that refers families to TANF, FRCs, and differential response. So it's important that we understand that this science is not only academic, it's actionable. If we're to achieve a family and child well-being system, we have to have the human service sector and child welfare point its efforts together to child and family well-being. It's policy making around prevention. And it is about equitable policymaking and service design reorientation. We do have a TANF policy brief that's specific to this evidence that you have access to as part of your resources. It was fun to put together all of the evidence around TANF specifically, but please know when you review this brief that in the background is this 30 years of science that's goes far beyond the science that's specific to the intersection of TANF and child welfare. We had the great good fortune of partnering with APHSA to create a policy tool that takes all of these studies and lines them up in a kind of in a narrative form. All these key findings that we've extracted from the literature and bump them up against, well, what are the policy choices that states can make? And put it all on, like, right together on a page. It's like a bunch of pages, but you get, you know, it's taking it out of slides and putting it into something that's really actionable. And so maybe my aspiration here is for you all to think about this broad policy context. You all likely have access to your child welfare policies and decisions, child care, child support, TANF, all the ways in which you do programming with those dollars. Think broadly. Don't think narrowly. Be broad and bold in how you think about what your work is over the next year together and what you can say to the country about that. I'd also encourage you to think about the ways in which you influence macroeconomic policies beyond the policies that at the state level you have access to, right? There are many federal policies that we have evidence for, earned income tax credit, the child tax credit, child care. You also have ways in which you transfer TANF dollars over to child welfare, and you can look and see the extent to which those dollars are spent consistent with what? The first purpose of TANF. So I'd encourage you also to take a look at this. And this takes that overloaded truck metaphor and all of the evidence, and not all of it, but much of the evidence, and gives it to you in a one-page infographic that's about helping to stabilize and offload the burden from families through our macroeconomic policies, our concrete supports, our public benefits, and creating a firewall or an economic differential response system so that child protection and foster care, way down here at the bottom, really does become the system for intervening when children are at risk and imminently are in danger after we have really pointed our resources in a different way that focuses in on prevention, family stabilization, and ensuring that we are preventing the deployment, the activation and deployment of the government's most intrusive intervention of being able to walk into a family's home, investigate, and remove their child from their family. This is where you can get all of those resources. It's in your packet. I'd encourage you to take a look. And thank you ever so much. Okay, pop quiz. Anyone?
John and Jeanette will have microphones, so if you guys have questions, they're ready for you.
Or insights. I'd love insights or thoughts or as well. You all are more experts in this than I am. I'm bringing you science. You all are seeing this on the ground every day. Yeah.
I just wanted to speak on the individual you were talking about, that created policy in 2003.
Yes.
Anti-poverty program. I really like that because being on the reservation, we have a lot of poverty, and then our stateside social workers don't see that side like we do. So it kind of becomes like an argument amongst us of like why they think children should be in child welfare, and we're like, no, that's just how our families are on the reservation. Like, we're not judging them based on our poverty. And so it's really hard to work with state workers on that. But I really like that
Hopefully
anti-poverty
this
program.
learning community will be helpful to you and to all of us in this way. And all of this evidence, I hope what it does is provide you with tools. It's a tool. Any one of the studies is a tool. All of them together is a tool. The infographic, the policy analysis tool, all of it are tools that you can take and use in those individual conversations, but also at the leadership level as well. Thank you.
Thank you.
I always like to challenge our thinking on child welfare and child protection. We all are child welfare, and we use that term loosely. I've been at DCS for 12 years. We're child protection. So we should be the last person on that spectrum to get involved. Child welfare is all of us. We make up that, but they've used child protection as that resource. We don't have resources, we have services. So there's a difference. So in this work, I like to challenge us that we're child protection, but we all make up child welfare.
That's beautiful. Thank you. I will echo that. And one way that we've started thinking about this at the encouragement of Juyen Chang at the Doris Duke Foundation. She's a terrific thought leader. You know, one of the things that's happening is, and I said this a little bit earlier, but I'll say it again based on your comment. I'll say a little bit more about it. Everything that's happening upstream, where families are having these economic shocks and somebody's saying, oh, they belong in, this is a family that needs something. I've identified a need. They need something. Kids are maybe at risk, or their well-being, or their, This isn't a good situation for children. They report that to CPS. What happens? What happens, CPS? We say, that's not our family. You know, that's not our family. And they send it back like, no, no, no. We screen them out and then we do nothing. Like 7 million kids are getting reported to the child protection function every year. And we are screening out half of them, right? So then they're kind of caught, right? Like it's clear they need something. This system up here hasn't met the need and it's reported them. This part of the system says, not mine. And then there's like that volatility and turbulence and we leave them in that spin. And then what happens? They come back, right, Nancy? They come back. And eventually what happens? And then eventually we're like, oh yeah, it turns out, it was one of our families all along. And that's actually maybe not that's been our mental model. And in fact, it's us. It's all of us that have not figured out how to reorient our resources and supports to meet those needs. And so creating a strategy that is about meeting families' needs, addressing those economic shocks and income instability, and addressing the outputs of poverty that relate to child welfare system involvement are so important and such the opportunity for you all.
Hi, thank you so much. We've used your research in making our argument in Arizona already, so I really appreciate you sharing it with us again today. And I wanted to ask you, one of the things that we've experienced already in Arizona is this need to justify shifting funding toward prevention rather than reaction. And seeing that slide where you're talking about $1,000 annually to a family preventing an investigation, I believe it was, I don't know if I'm phrasing that correctly, but generally.
There are a whole bunch of studies, like we've got a $100 study, we've got a $400 study, we've got, again,
So my question is, we really want to be able to make that one-for-one argument. We might be spending 1,000, looks like we're spending 1,000 here and we're actually saving X amount on the back end. Are you seeing additional research in that area? We're having a difficult time really trying to make that economic argument, as unkind as it may sound. It's important politically, I think.
Yeah, I think that there are a number of studies that can be put together to help you make that argument. I don't think that there is like one study that does everything for you. Again, like this is a body of science, right? If you look at Hank Pulse, $1,000 additional per person in poverty. His estimate was there's nationally, if I remember this correctly, a $46 billion initial investment, but over a decade, I'd have to fact check myself on the decade, there'd be a savings of 153 billion, right? There's a study that shows a negative return on investment for every dollar that you spend on foster care, right? We have a fiscal estimate that lifetime burden costs accrued annually for investigations comes in at around $2 trillion. That's a GDP kind of a number, right? So we know enough to make different decisions than we make now. I think part of what's happened with the science, in part, is that we forget, or we're looking for the perfect study to tell us all the answers. I picked up a book yesterday that kind of stopped me in my tracks. Peter Percourt, Casey Family Program, sent to me a book called Families in Crisis that he co-authored. It was an evaluation of the home builders model. Right? Most child welfare folks in here are home builders. It's an evidence-based practice. It's on the clearinghouse. A component of home builders includes concrete supports to families. And you go back and you look at the evaluation of this like more than a decade ago, citing studies to the 80s. that it seems to be that the concrete support is kind of might be the active ingredient in some of these evidence-based practices. So we know enough. We've got enough to put together, and I'm happy to help you make that argument. But that might also be part of what the learning community takes on, right? You all are, you're transferring some of your TANF dollars that come to you back over to TANF to test the extent to which those dollars make a difference in re-reports, right? You all likely are probably going to explore that kind of a strategy over the course of your year together. But what if you start today writing down what are the things that really we want to be able to say a year from now? I think the return on investment question is a really important one for you all to noodle on and to think together on. What is it, or how do we put the evidence together as a learning community that makes that clear for people to use in their decision-making process? So every question that you have rattling around is fodder for your learning community. I know at the beginning, as everybody was introducing themselves, I heard a lot of, why am I here? I'm here to learn from each other. Actually, I think that you're here to challenge each other and to come up with something that's actionable for many other states. And this is a great example of something that would be a real contribution to the conversation. Like, who do you need to help you with that? You probably need some sharp pencil people to help you with that. It's not me. I'm not your sharp pencil person. I can connect dots I can like abstract stuff and put it back together and help us see things in different ways. But like maybe you need a fiscal expert to come talk to you as one of your core activities. I am so deeply grateful. Oh, good. We got more. Oh, yay. More questions.
Go ahead.
So I think one of the things that we don't talk about is that the mindsets of staff who work both on the TANF and the child welfare side, but sometimes how we perceive families.
That mental model.
Yes, gets in the way of doing what I think is right for the families. Can you talk about that?
Yeah. You remember I opened this with my own epiphanies, my own set of mental model shifts. I think it's critically important. We all get into this work for a whole bunch of different reasons, right? And we all have a set of perceptions about people. It's human nature to other people. It's just part of how we're wired. Are they me or are they not me? And so this evidence suggests to me a different way to think about that. I've been hopeful that the pandemic gives us a different language or a different collective experience about what it means to have everything taken away from you overnight. And that perhaps there's a new opening for thinking about this differently. There's also a New York Times story today. It's called I Live in My Car. Anybody seen it yet? Go read it. It's a really great way to understand that that is all of us. Social worker working for the department in Washington State, making $72,000 a year, has some economic shocks, some predatory lending, a little bit of predatory capitalism. And before you know it, she and her daughter and her dog are living in her car. It's all of us. There's no difference among any of us, right? And when you look at, if you go back to this you know, the slide at the very beginning, when we look at economic hardship in the country, right? There are also structural and systematic things that have happened. There's, you know, there's redlining, there's the inability to get a house loan. There, you know, right, it gets us out of this, is it any one individual? Because what you're talking about here and what you're talking about is that we center that there must be something wrong with the person. Our systems and our policies are equal targets of our interventions. Thank you for that question.
Thanks for the presentation, Claire. I think what kind of stood out thinking about this was the Vermont example that you showed. And I think, you know, not to speak for California necessarily, but a lot of the conversations that we had initially were just sort of like going back to the point about the bifurcation between systems, the differences between like the county or state administration of
Sure.
child welfare programs, that there may be a difference between on the other end, there may be like a county or state administered TANF program. There may be a misaligned. So I was wondering if you could speak to the Vermont example, if there was any other research there around like whether there's a difference between being able to make those sort of comprehensive economic firewalls with that bifurcation between systems.
Yep. I can't tell you anything more about Vermont, but maybe someone else in the room can. But I will say this, and it goes back, I think, probably to the challenge to you all. The opportunity that you all have is to figure out how to get ahead of that firewall. That if you all together collectively end up focusing solely on that firewall, it's too late. And I would say that from a developmental arc, putting TANF and child welfare together has to date typically resulted in focusing on that space, right? And your opportunity, I think, is to figure out how to take your TANF dollars and your TANF decision-making and your child welfare dollars and your child welfare decision-making and pointing it way before that firewall is needed. And to make sure that when that doesn't work, or it's not enough, or there are sufficient challenges in the lives of families that cannot be overcome with that firewall includes resources, it includes evidence-based practices, it includes the kinds of social connectedness and resources that meet families where they are with the challenges that they have, right? Because that's not going to work for everybody, right? It's just not. I mean, I spent the first decade of my career working in the emergency room at Children's Hospital on their child protection team. I am very clear that a child protection function is essential. I don't think it needs to be pointed at as many families as we pointed at by any long stretch. And that by pointing our resources here together collectively, plus other resources, again, it's not just you guys, it's a bunch of others, right? Can make an enormous difference, allowing this function to be far more robust, helpful, and clearly designed in a short-term way to keep kids safe when they're in danger.
I don't think I need it. I can't help but think about the education piece around this and thinking about, to Ella's point, the frontline worker training, where they get trained on systems and how to plug information in, but I don't remember there being, when I was a TANF leader, anything on poverty education. And the same thing applies for the public knowledge, right? Because there is this
That's right.
perception about what poverty should look like, and if it doesn't, then people are treated in a certain way. So my question is, are there advancements or discussions about that education and training around poverty for organizations like these and also the public?
That's a great question. Can you all put that on your list? Actually, there are a lot of things I should have named, but I just think that that one's really, they're all critical. And that one is as well. I think there are, I think that there is a societal education to do here. I don't think that as a society that we realize that our set of policy decisions have this downstream result. And I think it might be an important opportunity. You know, when I see a number of public interest surveys, and contrary to like what our mindset says, actually people care a lot about families and kids. And I think framing this in a way that helps them incorporate this evidence in a new way might be really important. And it's true for our all the way down to our child welfare workforce, our TANF workforce. When you open with education, it's really important for our education staff, like our educators out in the world. Educators are the highest reporters to the CPS hotline. They have the lowest substantiation rate of those reports. They don't discern what really should come to the hotline. To family resource centers and to childcare centers. Who's like way down low at reporting? Childcare. And they've got the population of kids who are like most at risk. Why is that? I'm really curious about that. My hypothesis is they're actually helping families. I mean, not that educators are not. I retract that binary way of the educators are great. I have, but they're reporting at this really enormous rate and figuring out like what is it? So yes, absolutely.
Dean, I just wanted to respond. So Louisiana's Department of Children and Family Services has been working for the past 3 or 4 years to educate both executive leadership of the agency and then subsequently frontline staff about poverty. And they've been working, and actually Secretary Ricks last week spoke at NARS about how transformative it's been for the whole department to really just focus on what is poverty, what does it look like, what effects does it have on people. And it's created a level of empathy, I think, that gets lost in the sauce of administering a large agency. So yeah, so they've done it, and they're really committed to keeping it going.
All right. Well, can we say thank you to Claire?
Thank you all.